notes. Pero pwede naman na din mag-encode with the midterms and the finals. Don't worry, wala naman exam. So, ang ano naman doon is, I just want you to retain what's the information for today. Okay? Because I'm not planning to have the quiz today. Dahil, yeah, kasi medyo windang ako lately because we are trying to finish the manuscript for the graduate thesis. So, kulang din ako sa tulog. Okay? So, even if I have announced that there's no quiz, but please take note of the things that you need to do. Lalo na kapag when I inject verbal information, because from my verbal information, I may be asking that on the written exams. Okay? Alright? Sige.
Noted, Pete. Ay, naku. Eh, di pasado. Eh, di nasabihin
Tatlaw.
Ay, may grade na sa portal. Share ko lang.
Anong subject?
Orto, OS, DPH, interdisciplinary.
Sige po, start ko na po yung report namin, Group 4, about treatment planning. So, saglit lang naman siya. Mamaya nyo natignan yung grades. Sige po, for the treatment planning, also called the master plan or the treatment plan, includes all aspects of the oral cavity. Short-term goals and long-term goals of the treatment are all incorporated in the treatment plan. Overall, the total establishment, restoration, and maintenance of periodontal health are the desired outcomes of the entire treatment. So, ito yung difference ng treatment plan dito sa may PERIO form natin kumpara dun sa compre form natin. Kasi sa compre form, hindi natin pinapaabot hanggang PERIO, hanggang recall yung treatment plan. So dito po sa treatment plan ng PERIO form natin, meron siyang hanggang recall. Mamaya makikita natin. So, next. So, we have 4 major aspects in periodontal treatment, which is the phase 1, non-surgical phase, phase 2, surgical phase, phase 3, restorative phase, phase 4, maintenance phase. So, yun nga, yung difference na ito dun sa compre form natin, hindi naman natin nilalagay dun yung phase 1 to 4. Pero yung pagkakasunod niya, ang similarities nila, usual, kung ano yung nandun sa simula sa compre form natin, yun din yung dito. Kumbaga yung scaling and polishing, NSRP, isusulat natin. So, next. So, for the dental procedures to be performed under every treatment phase. So, ito po pala, there are 4 major aspects in periodontal treatment. Pero po ang pinaka-inuuna natin usually is yung preliminary phase. Comes before these major procedures. The preliminary phase treats emergencies in the oral cavity or dental or periodontal. So, yung mga dental procedures under the preliminary phase is the emergency treatment. Usually dyan yung mga may acute infections, yung mga pain, tapos sa teeth requiring extraction, depende siya sa teeth eh. Kumbaga yung iba, it may be postponed to a more convenient time. So for our phase 1, ito yung mga nag-under sa phase 1. So ito yung usually na sinusulat natin doon sa PERIO form under phase 1. So ito yung mga pwedeng criterias na isulat nyo. So, for the non-surgical phase, so play control and patient education pa lang siya. So, usually diet control. Usually yung mga patients na is with rampant caries. Tapos, removable of calculus and root planing. Yan na yung NSRP natin, non-surgical phase yun. So, correction of restorative and prosthetic irrational factors. Excavation of caries and restoration. Antimicrobial therapy, occlusal therapy, minor orthodontic movement, provisional splinting, and prosthesis. Mamaya may mga examples kami niyan sa case analysis namin. So for our phase 2, dito evaluation of response to non-surgical phase. Usually dito yung pocket depth and gingival inflammation, plaque and calculus caries. Ito, surgical phase. Yung una is non-surgical, so yun naman lagi yung inuuna natin, scaling and polishing. Tapos next, dito na po under yung periodontal therapy, including placements of implants, endodontic, saka extraction of tooth. Yan. So, sa phase 3, restorative phase na siya. Final restorations, dito na yung FPD. Siyempre, after natin magbunot, antayin natin mag-heal. Doon papasok yung phase 3, which is saka tayo pwede maglagay ng fixed and removable prosthodontic appliances na katulad ng sinasabi ni Doc Acosta, usually after natin magbunot, at least 3 months. At least 3 months siya. So, hindi pa tayo nakapagbunot, guys. Kung yung case natin, FPD or LPD. Hello! Pag-pray natin hanggang December. Sana Doc hanggang December para umabot kami. Tapos, evaluation of response to restorative procedures. And then, periodontal examination ulit. Next. Ito na yung last phase, maintenance phase. So, periodic rechecking. Ito nga yung katulad ng difference dun sa compreform natin. Itong maintenance phase, hindi nakalagay dun. So, sa PERIO form natin, ito yung pinaka-last, which is yung plaque and calculus period. Yung recall ba, pag periodontitis yung patient natin, 6 weeks. Pag gingivitis, 2 weeks lang. So, gingival condition, pakas inflammation, i-ano ulit natin yan, ipapacket dep ulit natin, probing. Second probing dun sa periform natin, yung sa pinakadulo. Yun, final probing natin yun. Tapos occlusion and tooth mobility, saka other pathology changes. Okay, case report na po. So, for our case report, it is a multidisciplinary approach of an endoperioral lesion in a severely compromised tooth and one 18-year follow-up case report. So, a 49-year-old woman patient presented a significant dissatisfaction with the aesthetics due to the gingival recession of a tooth located in the anterior region of the mouth. This case report describes the diagnosis, multidisciplinary treatment, and long-term follow-up of severely compromised tooth in a patient who was referred for assessing a gingival recession. Clinical evaluation of the left maxillary canine showed 12 mm of mid-buccal gingival recession. So 12 mm na siya. Usual natin mga 6, 5 for periodontitis. Probing depth of 14 mm on the mesial buccal aspect and grade 3 mobility. Periapical radiograph revealed extensive periapical and lateral radiolucency. So ito siya, sobrang baba niya na. So for our phase 1 non-surgical phase, ang ginawa is oral hygiene instructions and generalized scaling and root planing. Siyempre, importante talaga guys yung oral hygiene instructions kasi pag hindi natin in-inform yung patient natin na kailangan nila tulungan yung sarili nila, tayo rin yung mahihirapan kasi hindi mapipirmahan sa tally sheet yung perio section natin. So kailangan natin sila paulit-ulit sabihan. Kunyari pag naninigarilyo, katulad nga ng sinabi ni Doc Acosta, patigilin natin, hindi inom. Diba? So kailangan natin silang pakiusapan kung gusto natin tawagan araw-araw pwede. Kasi mahirap, pag hindi natin na-instruct, hindi talaga minsan hindi talaga nakikooperate yung patient. Magtatagal tayo sa clinics. Anyways, generalized scaling and root planing, a temporary splint was created to control the tooth mobility and to improve the patient's comfort and function. So kung mapapansin nyo, naglagay siya ng splint para hindi masyadong gumalaw na yung ngipin kasi tooth mobility 3 na siya. So konting galaw lang, matatanggal na yun. So for phase 2 surgical phase, nag-root canal therapy was performed after the temporary splint. Oral surgeon decided to perform root coverage with the LPF with SCTG on tooth 2. Mamaya makikita natin kung ano yung ginawa. So after, sa phase 3 naman, restorative after the lesion had completely resolved, a crown was placed at tooth 2-4 for aesthetic purposes. And then for phase 4 maintenance, the patient was recalled for professional tooth cleaning every 4 months. For the first year afterward, she was enrolled in a 6-month supportive periodontal therapy. Probing of the treated area was done every 6 months. clinical examinations at 2-year and 18-year intervals post-surgery was done. So ito, a vertical releasing incision was made extending beyond the mucogingival junction so that the pedicle flap could be reflected without tension. A split thickness flap was elevated, leaving the periosteum attached to the bone surface in the region of the mesial and distal papilla of the treated tooth. The epithelium was removed, leaving the vascular connective tissue in place. The exposed root surface was accurately debribed through a sharp curette. So kung yung LPF kanina na sinasabi, yun yung lateral flap. Ito yun, yung size yung tissue na kabila na may makapal na tissue. And then yun yung ipantatapal doon sa ngipin. Next. So the surgical area was dressed in a wet gauze pack and an SCTG was harvested from the palate. The size of the graft was based on the area of the receptor site. The graft was positioned at the height of the cemento-enamel junction and was fixed with 5 to 0 silk by single interrupted suture. So ito yun, yung clean up, tinangtapal dito yung tissue and then tinahi siya. So flap was laterally rotated to cover the exposed tissue and sutured with 5-0 silk. Single interrupted sutures were used to primarily stabilize the flap, provided that no tension was created. The patient was prescribed 600 milligrams of ibuprofen and was instructed to rinse with 0.12% chlorhexidine gluconate. Post-operative instructions were to apply ice packs, consume soft food, and avoid brushing the surgical site. So, next, the post-operative healing was uneventful. At the 6-month follow-up, the canine's root surface showed a 7mm recession representing 97.7% root coverage and a 13mm gain in attachment. Additionally, there was an increase in buccal keratinized tissue height and thickness. For the lateral incisor, the root surface exhibited a 1.5mm recession. So bumaba na yan. The post-operative healing was uneventful. Naulit. Yan, ito after 6 months.
Alam, galing. Galing ni Marcel.
Parang walang nangyari. Okay na siya.
Si Marcel.
Next na.
Nagawa niya yan. Galing mo naman.
After 2 years, guys.
Grabe, 18 years.
After 18 years. Yun yung kunin nating patient para after 18 years.
Grabe, 18 years.
Summary, the treatment began with oral hygiene instructions and full mouth debridement, followed by immediate endodontic therapy. 4 months later, periodontal evaluation showed probing depths within 3 mm, and radiographs indicated a slight decrease in periapical and lateral radiolucency. A decision was made to perform root coverage using a laterally positioned flap and subepithelial connective tissue graft. 6 months post-surgery, the root surface exhibited 1mm recession, achieving 91.7% root coverage and a 13mm gain in attachment. The patient entered 6-month supportive periodontal therapy with successful radiographic and clinical outcomes over an 18-year follow-up. Proper diagnosis is critical for effective management of endoperiodontal lesions. So proper diagnosis talaga. Saka wag tayo kukuha ng gantong patient. Yun po. Thank you.
Any questions on the group? Wala? Alright. If you notice, when we do our treatment planning, it comes in phases. So I was actually expecting at your exam that there are phases. But most of you doesn't have the phase at all. Okay? So with this, treatment plan, okay, is what makes you different from other practicing dentists. I know it's difficult sometimes to have it on parating on the computer, tapos making up all of the treatment plans for your patient. Sometimes time-consuming talaga siya. But treatment plan is actually the one that makes the money in. Okay? Bakit? Because a treatment plan, not only that you plot the phases of treatment for your patients, okay, customarily, meaning on a customized note, because not everything has a universal, okay, treatment plan. Normally in the practice, ang treatment plan may kakibat yang financial plan. Okay? So, usually, you can have it by phase if how much your patient should be willing enough to give. Okay? Because in our practice, in my practice, when I do conversation with my patient, malalaman mo if the patient has money, has budget for it, or a little bit tight. So, you may converse to your patient if the patient would like to have alternative treatments aside from the optimum should be treatments. So, you can have the good, better, and best. 3 options for them. Okay? So sa treatment plan, not only you plot the treatment, but beside the treatment, you may indicate how much they would be costing on these kinds of procedure. And also, you need to indicate the time frame. Because oftentimes, may mga pasyenteng Russians, always on the rush. Okay? Lalo na at this time of the year, ang daming OFW na umuwi. At they have very limited time staying here in the Philippines. Okay? Tatawag yan, Doc, I'll be flying in Manila from, let's say, United States. I only have barely 2.5 weeks, but I need my prosthodontic case to be done. Or I need my dentures to be done. So you have to do your timeline, you have to do your treatment planning if the timeline of the patient having their stay here in the Philippines would be sufficient enough in finishing the case. Okay? May mga ganong pagkakataon. Alright? Lalo na kung if you do have the capacity to work fast on a very slim window time. Okay? Pagka ganyan, dapat kabisado nyo na yung dental laboratory ninyo na hindi kayo ilalaglag at last minute. Alright? Dapat marunong na yung work staff ninyo to work like a Russian. Everything is on a rush. But still working efficiently. Okay? Because you cannot do all at the same time. You need to train your staff. But sometimes, hindi natin, well, HR-wise na to ha, human resource management na. Kasi when you're a dentist, ganun ka rin. As the head of the business, you will inevitably or unavoidably manage people as well. And not all people are the same. May matino, may hindi matino. May tamad, may masipag. Lalo na kapag ka medyo you're widening your clinic into a mega clinic. Let's say you have 5 chairs. Okay? So, pagka gano'n ang note, you have to be very careful because sometimes ang dental staff mo ang maglalaglag sa'yo. Just like what happened to me last week. Okay? Well, hindi ko alam. Pero usually, every January ang renewals ng permits. Okay? Business permit, tapos lahat na ng klase ng permit, sanitation permits, lalo na with the Makati City Hall, BIR, tax mapping. But they decided, I don't know, this is just our first time encountering people from the government sector having an inspection on an October. Diba? Well, they can just easily come in any establishment and do inspection. Pero rarely they do have it on an October month. Ngayon na ulit, siguro kailangan ng jeans, you know? Tapos nun, first, it was the Makati Sanitary Division. Because ngayon sa Makati, I think Mayora needs to have so much funds dahil maglalaban silang magkakamag-anak na naman in the mayoral seat. Hinanapan, ang dami nilang hinanap. Okay, ang dami nilang hinanap because here in Makati specifically, if you're going to open here in Makati, be ready with a lot of headaches because per worker, registered worker, meron yan yearly na nire-renew yung work permits. Okay, may working permit na dito sa Makati. Lahat ng registered workers here in Makati do have work permits and meron yan mga medical clearances. Okay? Aside from that, it's the DENR. Okay? DENR meaning you have your hazardous waste management. Hindi nyo po pwedeng ihalo ang mga hazardous waste to a common waste. Okay? So, may mga ganon. Magkaroon ka ng lapse, automatic 10,000 penalty. Diba? After namin ma-plancha yung gusot ng DNR, kinabukasan, siguro synchronize sila eh. Kinabukasan naman si BIR, tax mapping. Kaya ako sinasabi, you have to manage your staff. Yung isang medyo may edad ko ng staff na kahit anong paliwanag mo, eh hindi niya iniintindi yung dapat niyang intindihin. Eh siya pa naman yung frontliner. Siya yung nagre-receive ng patient. Pumasok si BIR inspector. Hinanap ang mga kailangan na documents na dapat na nasa loob lang ng establishment mo. Ano sinabi niya? Ay, nasa accountant po. Ngayon, 10,000. Penalty. Buti na lang nahilot namin yung inspector. Diba? So, we cannot avoid that. So, you need to manage your patient for you to lessen, liabilities and cash outflow that are necessary. Okay? So, with this, babalik ulit tayo sa treatment plan. Sorry babalik tayo sa treatment plan. So, you have to indicate if how much would the cost your patient be costing your treatment plans. Okay? That is your roadmap. Okay? That sets you apart from other dentists na tinatawag namin na ambush or one-hit wonder treatment. Kung ano lang yung kailangan ni patient, yun. Okay? Sometimes, our patients needs to be well-informed na ito pala yung meron sila na hindi nila alam. Okay? So, treatment plan is what makes you different from other practicing dentists because marami ako nakikita ngayon na hindi na nagbibigay ng treatment plan. And treatment plan, it doesn't come for free, You have to charge for it. Okay? Treatment plan para yung blueprint ng mga arkitekto. Hindi yan libre. Okay? But of course, before you do your treatment plan, all of your diagnostic works should be there. You have your basis. Bakit ito yung pinaplano mo for them? Okay? Because with that, when they pay you for your consultation plus your treatment plan, pwede mo silang bigyan ng kopya ng treatment plan na binigay mo sa kanila. Okay? Kasi magpapaplot ng treatment plan, sabihin, tinignan mo yung bibig ko, tapos yun yung i-charge mo sa akin. Diba? So, be careful with the patients na parang shopping, spree, meaning, nag-ano lang sila, nagka-canvas lang. Yung mga ganong pasyente. Be careful with that. Kasi sabi, ba't ganito sa kabila? Ganito yung how much yung sa inyo, ba't ang mahal? Hindi doon na kayo magpagawa. Okay? Maraming ganong pasyente na i-kukumpira kayo hanggang sa bumigay kayo sa presyo na gusto nila. Do not be like that. Do not look so desperate about it. Okay? Kahit na nandyan lang sa corner si Judith, okay, ng mga bills, do not hard sell yourself. Okay? If you know your capacity, you have to exercise it. If you know that you can charge twice as much as your competitor, you can do it. Basta panindigan mo na kaya mo yung sinulat mo sa treatment plan. Okay? For example, in my clinic, I do not do endo. Okay? Even on my undergraduate years, I really abhor endo. Talaga naman. Kasi it's too precise, okay? It's too precise. That's not for me, okay? It's exactly different from prosto. That prosto kasi is a very forgiving treatment. Parang trial and error. Kung hindi mag-progress to din, do the other thing. It's not like endo na kapag ka hindi po pwedeng, ay, short ng 1 mm, okay na yan. No. So, pagka ganyan, with the endo, I do not do endo in my clinic. So, when I do the treatment planning, nilalagay ko doon kung sino yung gagawa. Okay? So, I can charge as much as I can because ang sinasabi ko, ang selling point ko kay patient, ito po is an endodontist. Talagang wala siyang ginagawa sa buhay niya kundi puro endo. Kaya kaya niya mag-charge because yung endo niya, even on a multi-rooted, kaya niya in 2 sittings tapos. Hindi mga ganon. Alright? Hindi kabawasan sa pagkataong dentista kung aaminin mong may hindi ka kayang gawin. Okay? No man sila. Mas maganda nga yun eh. At least you are partnering with special people, specialized people under the field of dentistry. Ako, if I do have patients who need surgery, I am tapping Dr. De Ocampo. And madalas, yung akala kong simple odontectomy na uuwi sa operating room. Okay? Dahil kasi nung siniti scan namin, yung pala nakayakap na sa mandibular canal yung tooth. Na that doesn't, it cannot be done on a chair side basis. I had several patients na OR ang kanilang odontectomy. If they do have the capacity to pay, why not? Kasi nga na namang paresthesia at the end of the day, di ba? So, with that, it saves you, okay? It saves you so much effort and time, but you can also still generate income. You want a tip and trick for this? Let's say, kunwari lang yung figures hindi to exact figures, right? Let's say I ask Dr. De Ocampo for a certain treatment under a surgery, okay? So, the patient has a very deep impaction which approximates the mandibular canal, and it's not recommended on a chair-side basis. Normally, ballpark figure, when we do collaboration with Dr. De Ocampo, okay, ang fee niya for an OR procedure of an odontectomy, kung sa chair side, mga Dr. De Ocampo can charge as much as 15 to 18,000 per tooth. Pero, pagka OR procedure, mga nasa 25 and above na siya. Okay? Kasi, kaya nga siya in OR because of difficulty in removing. So, she can charge as much. Pero behind that, doon nyo na pag-uusapan paano ang ratio and proportion ninyo. Is it na 60-40 basis, 50-50 basis, 70-30 basis? Okay? Good thing if you do have very close friends who are in the other industry. Like with Dr. De Ocampo, we have been together ever since undergraduate. Okay? So, sabihin ko sa kanya, wala masyadong pera. Wala pa masyadong pera yung pasyente, wala siyang budget for it. Okay, we can flex. So, how much do you would like to have it? Sabi, sige, I can give it this. Patungan mo na lang. Parang ganon. So, depende. You can converse freely, without any hesitation, at least kasi kaibigan mo yung gagawa. Okay? So, if you do have friends over here that most likely, okay, in terms of attitude na makakasundo mo long term, mag-usap-usap na kayo kung anong mga fields ninyong magiging specialize in the future. Okay? Kasi it pays to have networks. Lalo na when you do treatment planning. Kasi may mga pagkakataon hindi mo talaga kayang gawin ang isang treatment for a patient. Okay lang aminin nyo, hindi ka bawasan sa pagkataong dentista yun. Okay? So, like, Dr. Diacampo is my OS to go to person. When there's endo, that is Dr. Alex Capuno. Okay? Si Doc Alex ang endo namin. Kasi si Doc Alex is just near to my clinic as well. Okay? So, endo, sige, tatawag mo yung secretary ko sa secretary ni Dr. Capuno, so BFF na sila. So, kahit hindi pa sila nagkikita in person, magkakilala sila sa phone. Tatawagan ng secretary ko, yung secretary Dr. Capuno, Doc, hindi, yung secretary, secretary, may patient kami needs ng endo, kailan pwede si Dr. Capuno. So, ganun na yung coordination. Okay? Then, the secretary will be the one to coordinate all of the schedules. Then, after the endo, Dr. Capuno will be referring it back to the clinic if there would be other treatments like prosthodontic works. Pero si Doc Alex, mag-Gcash na yan sa akin. This is your part. At least kumita ka pa rin. Diba? So, again, it pays to have networks. Even if you don't know how to do a certain procedure. Pero as far as now, sabi ko nga, kung may magsispecialize in a certain field na within your circle of network, at least you know who to call. There was a time, speaking of networks, there was a time that I was having a difficult extraction with a patient, tooth number 37, okay? Sobrang ganit. The patient, syempre, is lying down. I was trying to get my fulcrum, yung pinaka-pangsungkit area na para lumuwag yung tooth out of the socket. Medyo gumalaw yung jaw ni patient, tumulas ang elevator, tumusok sa palate. Okay. Buti na lang may resistance na makapal yung keratinized area ng palate, pero nakita mong unti-unting nagiging red. Pero hindi siya dumudugo, parang hematoma. Nakita mong from gingiva na nagiging red sa loob, parang namamasa-masa siya. Alam mo yung nanglamig yung buong talampakan ko, buong pagkatao ko. Nung natanggal ko after an hour, tawag ako kay Doc Jen, saan ka? Bakit? Andito lang ako sa Centuria, sa likod mo lang ako, tara, dinner tayo, may kukwento ako. Nung nag-dinner kami together with her husband, si Doc J, they're both OMS. Their life has been dedicated inside the ORs. So, sabi ko, Jay, tuso ko yung palit, bakit naisip ko na, alam mo yung pagka nagkaroon ka ng accident, naiisip mo lahat ng anatomy sa loob. Ano yung na-hit mo, di ba? Diba? Ganun talaga. Nung tinry ko, i-compose yourself, sabi ko kay Jay, yun nga na halos natusok ko talaga. Yung mga elevators ko, mga slim and pointed, mga pangsungkit talaga. Tapos nun, sabi ni Jay, okay lang, kahit hindi mo naman nabutas yung alangala, sakto lang yun, okay lang yan. Kasi sila, okay, yung confidence level nila is quite high na because they're working inside the OR. Diba? Kaya nila mag-troubleshoot ng gano'n. Sabi ko, okay lang, huminga ka, baliwala yan, malayo sa ngalangala. Basta gano'n. Yeah, gano'n sila. Sabi ko, bakit gano'n yung levels ng kabakok versus them? Well, syempre, dahil nga OMS sila, they can fix things, inside the mouth. As in, sabi ko, sige na nga, kalmado na nga, kaya na nga tayo. Well, at least you have someone to balance your anxiety, okay? Kasi you have networks, okay, that can comfort you at times of need, okay? At times of need. Ayan. So it pays to have friends in the industry that can be, much more elevated than yours. Alright? Kasi sila Dr. De Ocampo, OR na sila na OR, hindi na sila nagja-general practice eh. Yes, hindi na sila nagja-general practice. Most of the time, nagmamandibulectomy sila, nag-tatighten yung screw ng panga, ganun na, medyo highfalutin dentistry na yung levels nila. Kaya yung confidence level nila medyo mataas na rin kahit mawakwak man kung ano man yung sa loob ng bibig. Kung ikaw, wala ka sa ganun level, syempre kakabahan ka, di ba? Nakala mo baka mamaya mag-profuse bleeding na si patient, tumawag sa gitna ng gabi, hindi makatulog, di ba? So, treatment plan is actually going to give you good night's sleep. Okay? Yung hindi ka magigising sa madaling araw dahil buhay pa ba yung pasyente ko? Alam mo yung may ganon. Okay? Kasi the story of us, Dr. De Ocampo, kilala niyo si Dr. De Ocampo, diba? And I was the one who's very eager to enter PCOMs. I was the one who's very eager to enter surgery before. Noong nag-board exam reviews kami sa University of the Philippines, ako pa yung kumuha ng application form for externship sa UPPGH. Okay? O sabi ko, tara apply tayo after ng board exam. Akala mo naman papasa agad, di ba? So, ganun yung confidence level ko, I think ahead. So, sabi ni Jen, parang ayoko. Sige na, sama mo na ako. Tapos, Dr. Ferraris. Do you know Dr. Ferraris, right? It was I, Dr. Ferraris, and Dr. De Ocampo. Kaya lang, per university under UPPGH, isang representative per university lang ang tinatanggap nila. Guys, externship, yung oral surgery externship ng UPPGH, isa lang from each university. And nung nag-apply kami, ang natanggap si Dr. Ferraris. Kasi si Dr. Ferraris ang pinakmatalino sa aming lahat. Okay? Tapos nun, sabi ko, hindi ako natanggap. Hindi ako natanggap. Sabi ni Jen, ako rin eh. Tapos sabi ni Simon, ako natanggap. Karapat dapat ka naman eh. Nilampaso mo lang yung exam eh. So, it ended up, it was Dr. Ferraris who entered UPPGH. So, at limbo kami ni Jel. So, after board exam yun, hindi mo na alam kung anong gagawin mo sa buhay mo, kung ano yung ikakaligayan ng career path mo, di ba? So, ako, I entered Metropolitan Medical Center. Ito sa surgery, hospital surgery, pa rin siya, practice or training. Pero it's only once a week. It's not like full-time dedication like with UPPGH. UPPGH, nagto 24 to 48 hour shifts sila eh. Okay? Talagang hardcore hospital dentistry kasi sila. Unlike with other training programs na surgery pa rin, mga once a week lang na pwede ka pa magtrabaho, di ba? Tapos, Dr. De Ocampo tried with De Los Santos, Quezon City. Kung ako, Metropolitan Medical Center, si Dr. De Ocampo pumasok sa headquarters ng PCOMs. She tried the first 2 years kasi ang hospital dentistry is for 2 years. Kung gusto mong gawing residente as OMS ka, sasagarin mo ng 4 years. Nagustuhan ni Loka. Okay? Nagustuhan niya. So, sinagad niya up to 4 years. Yung the last 2 years niya, dun siya sa Taiwan. Dun siya nagtapos ng OMS niya. Okay? So, yun yung story namin. Na initially, ako talaga eager beaver mag-surgery. Pero nung napansin ko hindi ako makatulog sa gabi because of it, parang pinakawalan ko yung passion dun sa surgery at nag-prosto ako. Okay? Tapos Dr. Ferraris naman, when she applied for Mumbushu scholarship under Japan, she was granted scholarship. Lumipad siya ng Japan. Sa Japan kasi walang masteral program. Ang graduate program nila, diretso PhD. Walang masteral sa Japan, diretso PhD siya. So, si Dr. Diocampo nag-Taiwan, si Dr. Ferraris nag-Japan, kahit na nga ako kung puntahan sila, ni isa wala akong pinuntahan. Ganun talaga. Very busy ako sa life noon eh. Siyempre, when you are already, after the boards, so what's next? Kasi kakatapos mo na school, kakatapos mo na itaguyod yung board exam mo. So, susunod, diba? So, kanya-kanya na kayo pagdating sa stage na yon kung ano yung i-pursue ninyo. Yun. Okay? Kung may gusto mag-pediatric, that's the less road travel. Okay? Kung yan, yung mag-pediatric. It's highly recommended that maybe one in your class may pursue pediatric dentistry.
Si Clark lang.
Yun. May kung gusto mag-PERIO, yes, kasi kaakibat ng implants is PERIO. Okay? Kung may gustong mag-surgery, yan, mag-PCOMs kayo. Okay? But what I suggest, wag lang kayo yung puro 6 months training. Okay? Be above the game. Get an MS degree. Okay? Kasi at least when you do have the MS degree, may karapatan ka ng magsabi na specialista ako. Yun. Okay? When you do have that university degree, legitimate ka ng tawaging specialista. Hindi yung nag-implant training ka ng 6 months, sasabihin mo yung sarili mo, implantologist ka na. No. Okay? That's a no-no. So, if you would like to go to a niche, alam niyo niche? Niche meaning you're just going to focus on one specific field, then maximize your potential there. Unlike with general practitioners na kahit lahat pina-practice niya, pero alam mo yon, konti lang yung kaya mong kitain. Kasi you cannot charge as much as specialized people can charge. Diba? So, isipin nyo na, usually sa undergraduate, naiisip na kung ano gusto nilang specialize. Pero sa akin, napaka-late bloomer dahil at the last mate ko nasabi, ayoko na pala surgery kasi hindi ako nakakatulog sa gabi. So, yun. Depende dito sa clinics kasi, dyan nyo malalaman kung ano ang strengths and weakness nyo. Ako, ever since ayoko talaga na endo, most likely pediatric talaga na gusto kong ihagis yung bata sa yes. Wala akong pasensya sa bata. I'm sorry talaga.
Pero kasi pediatric.
Yun. So, with the treatment plan, it always boils down to the treatment plan that when you do treatment planning, do not quantify out yung mga things na hindi mo kaya when you can source out manpower. Kasi that is, sayang na aspect of income to your clinic. Okay? So, get your networks firm. At least kapag may tumawag sa'yo, Doc, I need an implants. At least you know where to call. Okay? Kikita ka pa rin naman dun kahit hindi ikaw yung first hand na gumawa. Okay? Pa-income pa rin yun ng clinic. Okay? Kunwari, Doc, kailangan ko ng endo, ASAP. At least may matatawagan ka still within your treatment plan. Okay? So, that's how things are when you have already your clinics. Kasi maraming old school dentists na hindi gumagawa ng ganito, ng ganyan. They're not open to trainings or they do not have network. Sayang yung potential ng practice. Diba? And if you have the capacity to hire associates in the future, wag kayo manghihinayang na mag-hire ng mas magaling sa inyo. I-set aside niyo yung ego niyo, ha? Okay? I-set aside niyo yung ego ninyo. Na kapag naramdaman yung mas magaling yung associate sa inyo, get them. Okay? Get them. Hindi yung, ay, mas magaling, baka mamaya sa pawan pa ako. No. Don't do that. Because sila ang magtataguyod ng practice din ninyo. Okay? Hire better people than you. Set aside your ego. Okay? Alright? Do you have any questions about this? Clarifications on treatment planning. So when I say treatment planning, if you notice the treatment planning starts with PERIO, ends with PERIO. Dinaanan lahat ng fields of dentistry. Okay? So normally, even on a universal note of treatment planning, yan talaga ang format niya. Okay? Ganyan talaga ang format ng treatment planning. So, starts and ends with PERIO. Ngayon, PERIO is a road less traveled field, but it's now gaining attention kasi nakikita na namin sa trend ng enrollment ng Masters in Periodontology sa Manila. Ngayon na, ang graduate school, swerte na yung 3 enrollees per semester. Ngayon nakikita namin may 10 na, 15. So, ibig sabihin, tumataas ang trend. Okay? Tumataas ang trend, it's okay. I mean, maganda sa atin, diba? But it's also a tough competition for you and I. Okay? So, pagdating ng time, approximate natin, let's say you're going to graduate, what, 2026?
Yes!
Claim it, 2026. So, July 2026, you'll be given, July, August, September, kung kaya nyo i-fast track ang board reviews nyo within 5 months, you can get the December boards. Okay, you can get the either December or ano lang naman yan, May. Okay? Then you can fast track it, get the December boards. If you don't feel like it, let's say May of 2027. Okay? By that time, 2027, okay, 2027, the Philippine Dental Association is already eyeing on a higher type of practice here in the Philippines. Parang nine-enhance na nila on how Filipino dentists should be. Diba nakwento ko na sa inyo that lahat ng specialization ngayon is on a reset? Diba? Totoo yun. Kaya ang dami nagkukumahong na kumuha ng NS just to set them apart from other people. Okay? So, with that, asahan ninyo at 2027 marami nang kumukuha ng NS or marami nang graduate to claim themselves specialized people. So, what sets you apart from them? Diba? So, yung iba, swerte kung may magulang kayong dentista. Okay, kasi kayo na magko-continue ng practice.
Ako na
Okay?
magko-continue kay Doc.
Magko-continue ng practice. Pero may downfall din ng family, family dentistry. Meaning, family of dentists may downfall. May kanya-kanyang downfall naman yun eh. So, with that, hopefully by December of 2026 or May of 2027, you're already done with dentistry school. Isipin nyo na on how you would be different from other practitioners. Kasi, mind you, it's a tough arena. Nahirap siya. Kung nahihirapan na kami ngayon, what more sa batch ninyo? Dahil between now and your batch, syempre marami ng bagong dentist. Okay? Alright, so that ends it. Next meeting, sino pa ba yung remaining reporters? Ilan pa ba? Sabay na natin ha? Because we have so much time. So sabay na natin yung last 2 reporters for next meeting. Okay? Alright? Okay. So, I'll dismiss you early. Thank you.